Gauteng en die Oos-Kaap ervaar tans skerp toenames in aktiewe COVID-gevalle. Het ons dit sien kom, is dit 'n krisis en hoe erg kan dit nog raak? Ek gesels nou met Professor Alex van Heever, gesondheidsekonoom van Wits. Professor, welcome to the show.
Good evening.
The Minister of Health struck a less panicky tone this afternoon, saying that we're expecting a flatter peak of COVID-19 countrywide. Is this good news in any way?
Well, I'm not sure where he gets it from. On the one hand, he's referring to model projections and peaks that come from model projections. And it creates the impression that he's been planning to fail in managing this epidemic all along. In all countries, the epidemics have been managed. The peaks that are achieved are not peaks that are projected by models. They are peaks that are achieved by suppressing the epidemic and reversing the trajectory pretty much in the way we've seen in the Western Cape. What we're seeing in Gauteng is a massive increase in new cases. It is completely unclear where this will end. And essentially what we have to do is step up both the prevention program as well as manage the consequences of this failed attempt to prevent the epidemic by trying to now scramble for beds, which are not ready in Gauteng, and services are not ready in Eastern Cape or in KwaZulu-Natal.
Professor, so the situation in Gauteng, was this not inevitable?
Not at all. This is entirely a consequence of not putting in the prevention programs that were meant to take over from the lockdown. So the argument was always at the beginning of the lockdown that this is buying time to prepare. It doesn't create a flattening of the curve if at the end of the lockdown you then basically do nothing from a prevention perspective and let the epidemic run amok, which is kind of what we're seeing.
Right.
The steepness of the rise in new cases is too great for that to be a consequence of anything other than a failure to prevent.
The number of deaths that we will see in Gauteng will hinge, to some extent at least, right, on hospital bed capacity. Is there a shortage at the moment? Because we're already reading reports about patients, even private sector patients, being driven around in ambulances for some hours, sometimes days, unable to find a hospital bed. What's going wrong?
Well, firstly, if you don't contain the epidemic, we don't actually have enough beds in both the public and private sector to be able to cater for the expected demand. So what we're seeing now is pretty much what would be expected from a massive surge in new cases. So there's roughly about a 10-day delay from where we see the big surge occurring and the increased demand and deaths resulting from that surge. So right now, we don't really have enough services to cater for the level of the epidemic at which we are now. In a week, we're going to be in serious trouble, and in 2 weeks, even more. So it is we essentially haven't prepared. The field hospitals that were set up here at Nasrec are completely unprepared to take patients. There's no oxygen supplied to them. And clinicians are currently scrambling to try and create a plan to get both doctors, nurses, as well as oxygen into those beds. But they weren't there and they haven't been prepared. The Western Cape has actually set up field hospitals ages ago, in which they set them up with proper oxygen supply, and they are able to staff them, and so they were able to cater for an overflow. So this is basically a failure to prepare both the prevention strategy as well as for a treatment strategy. I think that one has to be clear that government cannot have a narrative that somehow this was expected. What they've done is prepare for nothing.
They'll say, Professor, that they're preparing well in advance for 1.5 million deaths in Gauteng by digging 1.5 million graves. Bandile Masuku, the MEC for Health in Gauteng, said this afternoon. What on earth do you make of that?
Well, I don't know how many graves they're digging, but it is completely unacceptable that is part of their strategy. We had 4 months to prepare for this. You don't prepare by digging graves. That is basically preparing to fail. And I'm sorry, internationally, countries that have had this timeline to prepare for an epidemic have been able to put in place a disease suppression strategy that would have kept the epidemic at much lower levels overall.
Right, but surely that's a ridiculous number of graves to dig if grave digging is your thing.
Sorry, I hadn't seen the number of 1 million. I did see that they were digging an enormous number of graves.
Professor, is it too late? What can government do right now, it's mid-July, to improve on our prospects?
It's difficult to say because essentially we've kind of fallen way behind the curve. The only thing that can be done now is to consolidate any strategy that is possible around prevention. It is to understand exactly where the super spreading events are occurring within this epidemic, and to have intervention teams around those hotspots. It's also about understanding in now a lot of areas where we're experiencing real problems. It has also been announced and indicated that the disease is potentially airborne, which was not part of the messaging before. And this does seem to explain some of the cases that we're experiencing at the moment, some of the places where new cases are emerging, that in fact we have to deal with the issue of making sure that all key social spaces that we gather have adequate ventilation.
Alex van den Heever, thank you very, very much.